Hi guys, good evening if you're in America and good morning if you're in Philippines. I'm Dr. Jenny Yusuf, physical therapist and doctor of physical therapy, creator and founder of Balance and Fall Support Group in Aging Adults. I'm the vice chair of the Global Health in Aging Adults and also in the American Physical Therapy Special Interest Group. So here we are every Thursday. We call it Thanks God It's Thursday, another entrepreneur, another therapist, audiologist, different kinds of profession that we highlight. Anybody that helps us a lot, in the therapy world or rehab. So I have the opportunity to meet Dr. Joseph Sakumura. He's an audiologist and also the board certified CCC in audiology and senior vestibular clinician, chief technology consultant in American Institute of Balance. As an audiologist, he possesses expertise in diagnosis of the vestibular disorders. As a therapist, we met different kinds of problems, vestibulopathy, especially BPPV, but we will learn some of those terms tonight. And he specializes in technology associated with audiology and rehab. So if you will not know, we will learn more what is AIB or American Institute of Balance. It is a global healthcare based in Florida and internationally recognized in doing vestibular evaluation and trained almost 15,000 plus. And Dr. Joe is one of a great instructor there and of course the senior vestibular clinician. So without further ado, welcome Dr. Joseph Sakumura.
Yeah, thank you so much for inviting me, Jenny. It was a pleasure to meet you a couple of weeks ago at the workshop, and I'm thrilled that you've decided to have me on as a guest. Thank you.
You're welcome. I really enjoyed your instruction, your training, the hands-on, and how you deliver all those, especially in our certification. So, guys, we have online, and I attended also the workshop itself. So, Dr. Joseph, you are an audiologist. It's our first time to present an audiologist in the platform in the Balance and Fall Support Group. We have balance and false. So why, first of all, you are in this line? You can be pediatrician, you can be geriatrician, but why audiology?
Well, what an honor that I'm the first audiologist that you've had on the show here. So, most people, when they think of audiologists, they think of hearing aids and hearing specialists, just based on the term audio. But actually, the more important of the two parts of the inner ear, it gets its street cred for the hearing portion. But many of us neglect the part of the ear that's responsible for balance. So there are actually some courses within doctoral education, within audiology, that specifically put you on a path that studies not hearing, but the vestibular mechanism and the vestibular apparatus. So my training initially was actually in animal research and looking at the balance nerve and different studies within lab rats. And ultimately, I took more of a clinical pathway and ended up at AIB, not with a focus on hearing or hearing aids, which is also critically important, but rather on fall risk, balance, vestibulopathy, complex inner ear disorders that can result in dizziness, vertigo, and balance problems and these kind of things. So when you really look at, the scope of people that are out there that need help with these problems, you're looking at 90 million Americans who are under this belief system of, well, I'm a little bit older, I'm supposed to be dizzy, or it's normal, it's just part of aging. So the Institute really promotes a continuum of care for these patients that starts with medical evaluation, moves into technological diagnostics that are available for these patients, and ultimately, our good friends and colleagues and physical and occupational therapists are the ones that end up doing a lot of the rehabilitation for these folks. So it's really great to be able to educate folks on just what exists from a diagnostic and rehabilitation standpoint. And really the messaging that our belief system promotes is you don't have to learn to live with it. There are specialists like you and your network and people that can help patients with these problems.
Yeah. And then what inspires you? That's really amazing. Imagine it's more on the lab rats initially, and now you're an instructor. Now, always seeing lots of people. You have your own clinic. You're still doing it on your clinic, evaluating personally, but also an instructor. And I really enjoyed how you talk to us. Sometimes you're joking in between and things like that. You're so serious, and then it's a joke, you know? So it's really fun. And what inspires you to think? Is there a family member suffering with vertigo? That why you need also to look into it? Because we have many couples of therapists. Oh, my grandma had a fall, so I was linked in physical therapy. Any other history there?
Yeah, I think growing up, everyone knows someone that has had this problem. Dizziness and falls are so prevalent. And I learned very early on in my career that the medical system, for the most part, fails these patients because they jump around from doctor to doctor. The NIH estimate is that the average dizzy patient sees 4.5 doctors before receiving an accurate diagnosis and treatment plan. And by the time they end up getting into rehab or in front of someone who's a specialist in this, the patient is often very defeated. Maybe they're depressed, they've got personality disorders. So I kind of saw this pattern, not necessarily in one family member or one specific case, although I do have family members, many of them that have suffered from these kind of things.
Mhm.
But large scale, you just realize how important this is and how many patients out there need help. So my career started in the clinical. I saw patients every day, full time, evaluation, treatment of the things you talked about, vestibulopathy, BPPV. And then I started to realize, how can we help more people? Because I only have two hands, right? I can only do so many canalith repositioning maneuvers. I can only do so much therapy to help these patients. So the Institute's vision is to make vestibular and balance therapy approachable for everyone. Let's not kid ourselves. The science of vestibular can be very, very complex and difficult to understand and challenging. And that's a barrier of entry for a lot of clinicians. I've met a lot of therapists out there that say, I don't like vestibular, it's too complicated. I don't know how to
Yes.
help those patients. The courses I've taken are way over my head and I don't understand it. So you've got to make, when you're teaching this stuff, in order to help the masses of people, millions of people, not just 10 or 20 a week like I can do with my hands, you've got to teach it in such a way so that it's engaging, it's interesting, and it's approachable. If all we're doing when we're teaching providers, oh, you've really got to understand the physiology of the nerve and the bifurcation, and you make it complex, people put up a wall and it makes it not approachable and not something that folks are interested in. So our belief system at AIB, and you've now taken our courses, is to obviously ensure that it's evidence-based and it's scientific, but also that the content and the information is delivered in such a way that every therapist can help folks with these problems, because that's what the world needs right now. This is a tsunami of patients. We've got to, just like your group does, we've got to empower and educate all clinicians to help the dizzy patient, because there's that many of them out there.
That's really powerful to know that the goal is to make it more easy, simplify, and at the same time repeatable. Multiplicity, as you said, you cannot treat 1:10 in a day, and but because the knowledge has been transitioned to different clinicians, PT, OT, audiologists, physicians, those are the different clinicians that can take the AIB courses and certification. Did I miss some more? Because I said audiologists and physicians. I'm a
Yeah,
therapist.
athletic trainers
Okay.
also. We do a lot of
Wow.
concussion rehabilitation and those kind of things with
Yes.
athletic trainers. Yeah.
That's another point there because we're only focusing on one like vestibular, but the concussion is more on the sports physical therapist. We have lots of sports PT here as well, and they definitely can see that. So what can we just advise in our group? We have um geriatrics, let's say elder clients. So they said, "Oh, I used to live with this. I always falling because I have this dizziness and it happens like that." So what's the first thing we need to inform them that this is not normal? Is it normal? Something like that
Yeah.
for
So
clients.
there's a couple of different things to unpack there. First of all, to have dizziness or vertigo is never normal, and it's never something that you should just learn to live with. In that same conversation, falls are not normal, and nor are they something you should learn to live with. They make the mistake of thinking that general weakening of systems and reaction times and general slowing of different metabolic processes, the aging process, right, is impossible to slow down or stop. But fall risk management, right, and treatments and evaluation and thorough comprehensive assessment is the first step in figuring out where the problem is and ultimately leading to a solution. So it's a complete myth that I'm old, so I'm dizzy. I'm old, so I'm falling. Now, I wouldn't tell a patient that at age 80, you'll still be able to run as fast as you could when you were 14. That's not true. But falling is not a normal part of the aging process. So seeing a movement specialist like yourself, seeing a vestibular specialist like a physician or an audiologist that can actually do studies that objectively evaluate the systems of balance and where the issues might be residing. That's the first recommendation. If I was speaking to my mother and she was having these problems, I would say the first step is to find a clinician that knows what they are doing. The most dangerous thing that a dizzy patient can do is blindly pick a physician or an audiologist or a physiotherapist and say, I need help with this problem. You've got to make sure that that person has specialized training in networks like yours, because audiologists, physicians, therapists are not all created equal. So if you go to a therapist that's a shoulder specialist or an audiologist that's a hearing specialist, they may not have the tools necessary to evaluate and treat a balance problem. So I would recommend finding someone in a network or with certification or with an education base that allows them to be specialized in this realm, because a true specialist would never tell a patient, you're old, that means you're dizzy, you're old, falling's okay. So that would be the first thing that I would recommend to any patient or even my own family member if they were dealing with these problems.
Exactly. Totally agree with that. Especially the September is a fall prevention awareness month, you know. Many factors and fall is definitely not a normal part of aging. And vestibular issues is also not by age. You have clients pediatrics, you have clients congenital issues, and we discuss those things. So for a clinician, they will ask you. So that's for the caregivers, clients itself. But if the clinician exactly what you just said. It looks so complex. Oh, vestibular. I don't like that cases. That's the reason why sometimes I refer, BPPV or Vertigo, or we have less vestibular therapists here in the area. So I just ask them, you will benefit definitely with a vestibular therapist. So we will look for a clinic who specialize there, you know. So if I'm listening. I am a clinician. I would like to know more about it, but I am afraid to do more. So what's your advice for me for in
Yeah.
general, Dr.
My
Joe?
advice is, just like anything, be a lifelong learner and be willing to take a course. Listen, our course is very comprehensive and thorough, right? But there are courses out there that you can take at a very approachable price point. You can open a textbook chapter, you can read an article. So I think the first thing that I would recommend is, do what I would do and, start to do some research on the internet, start to look at some of the organizations that specialize in training folks of this caliber, and, find a way to simplify and make this complex topic make sense to yourself. And again, I may be a little bit biased, But I think AIB has great courses for entry-level clinicians. I think our courses are also great for more advanced clinicians. So I think before you open your arms to the dizzy patient, you've really got to have a strong understanding of the anatomy, the physiology, and some of the basic points. But it's an awesome push-off point. So after you've taken a course, the next thing I would recommend, because a lot of like the course you took, a lot of clinicians will come to me and say, I'm a little nervous to see my first patient. It's easy to learn this stuff in the classroom, but I have a patient on Monday. Sometimes you just have to do it. That's the best way to learn with a lot of patients. And you're not going to do the patient any harm. You're not going to set them back. But sometimes our patients are our best teachers. I've had a lot of preceptors tell me that. So once you have a basis of understanding of a knowledge base, start to see these patients and work with them and see what works in your clinical processes. And you've got to start somewhere. So again, it can be a little bit scary. It can make us as clinicians apprehensive. But ultimately, I think you've got to learn on the back end and acquire the conceptual knowledge and textbook things. But then you've also got to do the procedural knowledge
Yes.
of working with patients and letting them teach you.
Yeah, he even gave us a technique like, let me look for my video, something like that, right? You said just
That's
to
right.
review your hands-on and everything, because
Yeah.
at least the patient still will be more comfortable. Okay, good, you're checking your form. You'll never
Yep.
know, right? Yeah, because we're
Absolutely.
always afraid. Thank you so much. So we are being watched globally. We have many physical therapists who's watching right now. We also have some. I work in United Arab Emirates, so we have some Middle East. So do you think you are training as well? AIB can be. How about those people not in US? How they can access the different courses? Any online that, because somebody asked me she's interested, so I said I will ask Dr. Richard Gans about those things. So she's in Asia, but how they
Yeah.
can access the courses,
We
Dr. Joe?
we actually have a course special for international folks. It's called the International Vestibular Rehab and Concussion Certification. So
Hmm.
IVRC for short. If you go to dizzy.com, you
Mm-hmm.
can enroll in that exactly how you would enroll in the hybrid model that we have in the US. But because it's all online, in different countries, we also understand that different countries have different pricing structures. So the price that you might pay for that course in Japan or China versus India or the Philippines or wherever, we try to make it again. Our whole model is to bring down the barrier. So if folks may be in some countries that aren't as wealthy, they're able to take the course at a price point that they're comfortable with, and so on and so forth. So we actually have an international course for those folks.
That's awesome. Is it pure online? So how about the lab part? How they can practice? So
It's
what's the
only online, but
Mhm.
we do some presentations. I'll actually be with Dr. Kim and Richard. We're going to be in Dubai in January delivering a course. So just
Yeah,
like
I've
we do
worked
in a number
there.
of different cities in the US, we also do international work and present at a lot of conferences and those kind of things over there. So
Wonderful.
the other
Yeah.
thing you can do that I tell a lot of our novice therapists to do,
Mhm. Mhm.
how I might learn this, if I learn a new technique or a new maneuver, I might practice it on my wife. I'm not going to mess her up too bad, right? Or I might
Yeah.
practice it on my office manager or my sister or my brother. So you can practice on get comfortable with the hands-on and the manual portion of this in a number of different ways. But the international course has a lot of videos, some of those similar, the step-by-step videos of where the hand placements are and the actual techniques and those kind of things.
Yes, that's nice. And I met your wife, Mackenzie. So she's an occupational therapist. So that's easy to practice, right? So
That's
she will
right.
be a
Yep.
good model.
She knows how to
Uh,
tell me when I'm doing something wrong because she does this with kids, even
okay.
harder than adults. Yeah.
So it goes hand in hand. Thank you so much, Dr. Joe. So just for fun about your last name, tell us. Maybe they're expecting somebody Asian, Dr. Joseph Sakumura. So what is the story of your last name just to share before we close?
Yeah, my grandfather, my paternal grandfather, was the first generation Japanese immigrant. So he married a Swedish woman back in the 1940s. So my father's half Japanese, but also has very Caucasian characteristics, skin tone and these kind of things.
Yes.
And then my father further, right, went on to marry an Irish woman. So that's why I've got the complexion, these kind of things that I do. So I got a lot of jokes about, oh, is the man? Did you look at all like the mailman or the delivery man growing up, or any of these kind of things? So maybe you're adopted, but yeah. So I am actually a quarter of Japanese, and I still cook a lot of Asian food, and I love Asian culture. My wife and I are actually headed to Thailand here in a couple of weeks for
Wow,
vacation. So
that's awesome. How about the language? You know Nihongo?
no, I don't. I'm solely an English speaker with a little bit of Espanol. I took some courses,
Okay,
but
that's
no
amazing.
no Japanese. My father was fluent though, because
Oh,
he did a lot
wow.
of business in Japan.
That's
So
amazing. So my cousin is the one who lives and married a Japanese woman. So he is very fluent in Nihongo and also an interpreter, Nihongo and also English. So that's really, he's really good. So thank
yeah,
you so much for sharing this time, your knowledge, your expertise. We really appreciate you, Dr. Joseph Sakumura. So for our closing, how can we connect with you?
yeah. My email address is j.sakamura@dizzy.com. So please feel free to reach out via email and let me know how we can help. Again, the message here is that we should try to help as many patients as we can. And we at AIB pride ourselves on building that network of therapists to make
Yes.
this approachable so that we as the therapists and clinicians win. And more importantly, the patients win and they get better.
All right. Thank you so much. So, guys, that's Dr. Joseph Sakamura. So, we learned a lot. Vestibular issues, vestibulopathy, and dizziness is not a normal part of aging. It's sometimes you're thinking, oh, I just leave it. And falling contributes to that is not a normal part of aging. We have a solution as a clinician. So there are resources out there. So AIB doing some certification also in concussion. So check out with dizzy.com, and Dr. Joe is traveling in Chicago soon, Florida, and they will be in. Check the dizzy.com for all their schedules and events. So thank you so much, Dr.
Thank you,
Joe,
Dr.
and
Jenny.
have a good night,
Pleasure.
guys. Thank you for watching.